Welcome to the Africa Speaking Podcast. The podcast discusses critical issues about the African continent. It is brought to you by Toyeza Communications in Nairobi.
Welcome back. You are listening to the second and final episode of our compelling series. I am your host, Marceline Nyambala, and our conversation with Dr. Lydia Matoke, traditional healer, herbalist, and the president of the Herbal Society of Kenya continues. We'll uncover more specific examples of how their profound connection to the land and traditional practices provide essential strategies and directly contribute to climate change mitigation efforts. Let's explore their vital contributions. With the work that you're doing, we talk of best practices that you can say, this really works. If more people knew about it, it could be a medicine, it could be a way of life, something around your herbal medicine, a best practice.
Actually, our local nutrition works, our indigenous foods. When we talk about climate change, what food is going to be there throughout the year? Is it maize? No. Is it Irish potato?
Yeah.
No. What about wimbi? What about sorghum? What about cassava? Let farmers go back and start farming wimbi and sorghum.
Yeah.
Then we can be able to have a supply of a nutritional product which is good for cognitive health, which is perfect and good for diabetes, blood pressure, and cancer.
Or this one will counteract all this.
Wimbi.
Yeah.
I wish it could be the plant number one. Wimbi. Then sorghum.
Sorghum for porridge or also for ugali?
For ugali and porridge. And fermented porridge because of digestive bacteria which are good for digestion.
So it's going to prevent a lot of diseases.
A lot of diseases. Even cognitive health.
The issue of mental health and all that.
Yes.
What can the learning institutions, our schools, our universities, what can we do to build resilience, to build traditional knowledge? What would you recommend?
I would recommend we start from maybe primary.
Yeah.
We start introducing the subject of traditional medicine. While a student is choosing to go in for nursing, let there be a subject.
Yeah.
In that nutrition, the dietitians, let them get to learn about our indigenous foods, medicine and the traditional foods.
All that you're saying, do you think there is enough policy, enough legislation to support much of what we are calling traditional knowledge, to support herbal work, to ensure that these things don't disappear?
As much as there's so much that has been done, we have really written policies. There are bills which have gone to Parliament. They just take one statement. The Health Bill 2017.
Yeah.
There's only one statement which talks about development of traditional medicine. The whole of that document.
Yeah.
I remember from the year 2004 when I really started being involved in policy. Yes. There's so much that which has been done. Currently, we have a bill which we worked on under the Ministry of Health, Traditional and Alternative Medicine Bill. It is somewhere. 2010, they picked a statement from a policy which we were working on, traditional medicine and medicinal plants. At the same time, the policies which are there, or the regulations which are there at KEBS, at Farmers and Poisons Board, KIPI, and the rest, they are a bit high than what the African traditional healer can make.
The policies.
I think, yes. I think there's so much to be regulated within the frameworks which are existing. Like now at the Farmers and Poisons Board, the standard of registration, if I'm to register products, which traditional healer will be able to process that product unless funded again by the government or some other institution.
The threshold that they have put is so high.
It is so high. When we are told that this product is far below the British standard, what do you mean? by a British standard. I thought Kenya, we are supposed to come up with our own standards.
Yeah.
And the regulations. At the same time, the traditional healer is not registered under the Ministry of Health as much as I'm that which you have known me to be. I'm under culture.
Yeah.
I'm registered even as an artist. I'm just like a dancer, a singer.
And is it limiting, very limiting?
It is very much limiting because how do I convince the outside world that what I'm doing is recognized in Kenya under Ministry of Health?
Yeah.
What is recognized by that health bill of 2017, I've said, it is development of traditional medicine.
Yeah.
Then we have the indigenous knowledge bill, which went through under culture. So I'm indigenous.
Yeah, under the Ministry of Culture.
Yes.
And what kind of support, interaction do you have with the Ministry of Culture?
We thank them so much because we were not known until the Department of Culture said, no, we must go to the ground and look for these people.
Yeah.
Traditional medicine is wanted all over. Even before Corona, people had woken up and had said now they want to go and get the medicine, which they knew. It is locally available. It is cheap.
Yeah.
It can be, it is already recognized by the clan or the community. So the traditional healers are registered by the Department of Culture. They are the ones who embraced us, who have embraced our work. They have brought us this far. And again, we thank the Ministry of Health because of late now they are listening to us. We can be able to sit on the same table, discuss. Like now when we worked on the guidebook, they were there for us. We are together. We are working together.
What do you think made them change and become more receptive?
Who didn't become a herbalist after Corona? I think everybody is a herbalist.
People had to rely on...
Yes. I think that's one of the reasons.
Yes, because they saw the role that was played.
And now it is going to be even worse.
Yeah.
If America is not going to change,
it's turned.
Where are we going to get the ARVs for our people?
They are going to look at traditional medicine.
So I think now traditional medicine is going to be looked at, even if it is each disease, because HIV is not just one disease, AIDS is not one disease, cancer is not one disease. So I think we are going to look at arthritis, asthma, bronchitis, pneumonia.
But are there formulations that people already think they have that this has been very responsive from some of your networks?
For individual diseases, yes. We have very good products for different illnesses. Yes.
So what kind of support, any additional support that you require from the government that you can say?
I think one, if we can have proper, better regulated system, policies in place, then let them set funds aside for traditional medicine development. And as the older people, the older generation are going away, they'll die. They will die with the knowledge. Most of the knowledge which has been maybe safeguarded, it is at the universities. People have done projects on particular cases or even plants, but do they have the products on shelves?
The people are doing studies.
The people are doing studies. After you have graduated, your paper is in a certain university. Let them change. Let them get the results of the projects. Let them make them into a product for the country to benefit.
Are you getting adequate funding for your work?
No.
From all the medicines, the herbs that you have, maybe tell us 2 herbs that are on very high demand, and what are the issues they're curing, and which are the plants, and what is the status of that plant?
Right now, currently, the medicine which I'm really selling is handling digestive system illnesses. That is H. pylori, ulcers, E. coli, gastritis, even up to stomach cancer. That is the number one.
And you're relating it with the inadequacy of its issues to do with our diet.
I'm relating to that. Even lifestyle. And also the amount of medication modern medicine that people are given when they are suffering from H. pylori.
Yeah.
I'm looking at the current situation of ulcers and gastritis and stomach cancer. Most people, they give me a story how they have been suffering from H. pylori for many years.
Yeah.
Number 2 is infertility. And when it comes to infertility, it is not just a medicine.
Yeah.
That is where cognitive health comes in. That is why I think of the man health.
Yeah.
How are we going to help the man? Because the woman cannot get pregnant by herself.
Yeah.
So what is the health of this man? In totality. Where is his mind? What is his life? What is he eating?
Yeah.
How is he living?
Yes. Also, that is something that you're seeing.
That's something
There's a high demand for issues to do with the infertility.
As connected with cognitive health.
Which again comes to the lifestyle, food and...
Yes.
Okay.
Then number 3 is arthritis plus cancer. I'm saying arthritis plus cancer because cancer is more than 100 diseases together. To
make cancer.
According to me and my practice experience.
When you have cancer, you're
not suffering from just one disease.
Oh.
That one also prompts me again to cognitive health.
So once somebody has cancer, they're having over 100 diseases.
Yes.
Such as which diseases?
There's arthritis, they have pain. Some of them can develop diabetes.
Yeah.
Some of them have got hypertension.
Yeah.
Some of them have got heart-related problems.
It's
and the like.
It's not coming as one disease.
It doesn't come as one disease.
So most diseases are not singular.
They are not singular, and that's why I cannot use one plant to heal. And that's why even my grandmother never used one plant.
Yeah.
She used to combine them.
Yeah.
She used to ask this person whether she has a discharge. The grandmother would put a plant to stop that discharge.
Yeah.
Like that.
Is there a way you're building resilience around preservation, and how long do the herbs take on average?
We harvest, we dry, we process. I usually keep the powders instead of the leaves, the dry leaves.
Yeah.
It is easier and cleaner and safer to grind and keep the powders ready for combining.
So what do you use? Do you use the flowers, the leaves, the bark, the roots?
It depends which plant and for which disease.
Yeah.
Yes. Like now, when it comes to mwarubaini, I use the whole plant.
It's the whole plant?
The leaves and the seeds and the fruits. Then I use the bark. When I talk about the bark, we have the bark for the tree and we have the bark for the roots. But I'm discouraging everybody from the root, because if they are going to do poor harvesting, how are we going to sustain the plant when they use the root? So I'm training my people who go out to harvest on how to do wood harvesting practices, where they remove maybe one part of the skin, the bark of the tree, and we use soil or cow dung to keep that place safe so that the skin can skin can regenerate for another season. Maybe 1 or 2 years later again we can do the harvesting on the other side.
I watched somewhere that the healers, that there is a way you even communicate with the plants. Is this the case? There is a way you have to relate with the plant.
Actually, it is we the Africans who have gotten the traditional healer wrong.
Yeah.
Because our mental status is not what we were when we were created, when we came out of the hand of God and we were Africa. We think many things which we are doing are wrong. It is not wrong. When you go to the forest, let me talk from the Christian perspective. I sincerely pray for my work. I pray for my people who are going to go out there and do the harvesting, so that they can do clean work, so that they cannot cheat on the patient in any way, mixing the plants which they are going to for the harvest. So when the African community of traditional healers talk about going to the forest and communicating with the plant, I really don't know which language they used. But what I know it is talking positive, talking how this plant is going to be of use.
I hear you.
You understand?
Yeah.
Like
it is everything you care for. They say if there's a lot of noise, the plant will die. If the plant is, you're in a good mood, the plant will grow.
Surely, let me ask this question on that point. When I'm in a good mood, when I'm laughing and I'm smiling and I'm there singing and I'm picking the leaves which I want or the fruits which I want from the medicinal plant, isn't it the same like when you are going to the garden, you want to go and plant, you are dirty and you want to ask God to give you a yield, a good yield from your garden.
Yeah.
Do you go to God praying when you are dirty?
Yeah.
So when the traditional healer goes to the forest and talks up to the plant, he's just communicating what he wants the plant to do.
When you recommend to the herbalist that they grow something on their own kitchen garden, how has been the response?
There are some who are very happy.
Yeah.
There are some, especially those ones who don't have big land.
They don't have land. Yeah.
They don't have land where to plant.
Yes.
That is why actually I'm challenging the government sector who are in charge of planting the 15 million trees.
Yeah.
What are they doing with the local herbalists within that region? Have they included them in their nursery making so that they can understand and identify the medicinal plants which are extinguishing?
Yeah.
Like sandalwood, like fig, like Caria africana, Wabugia eucadensis, which are the best.
How can the youth be involved, the young women and young men, in ensuring resilience of these herbs, and how are you trying to involve them?
Seminars and workshops.
Yeah.
That's where we should start from.
Yes.
Because we hear people are planting trees.
Yeah.
Who has been involved there?
Yeah.
There are so many youths around who don't have anything to do. Why don't we, at the county level, even at the location level, at the sub-location level, at the sub-chief's office, get these youths, talk to them, let them get in touch with that office, and that is creating some occupation for them. Instead of us running after the youth, they have messed, they are doing this, they are doing that. How best are we really putting them close to us?
Yeah, and giving them opportunities.
And creating opportunities for them.
Yes.
And I'm sure many of them will be very happy.
Yeah.
Because some of them come and ask me, Mama, sasa after training, utanipa kasi gani? Meaning they have interest.
Yeah, but there's a whole issue about access to land for young people. What are the maybe creative ways that...
Where are they going to get land from?
Yeah.
You have been in Nairobi this time or these years.
Yeah.
You have gotten your children in Nairobi.
Yeah.
At home, maybe your husband was given a quarter acre.
Yeah.
Where are they going to belong? And we're going back again to streamline this sector called land ownership. And
can the government just allocate them land somewhere and say, okay, you're a youth group, you can use this space and supply? Actually,
that's why I was talking about reforestation.
Yeah.
It doesn't have to be my grandfather's land.
Yeah.
That youth, or the youth group, or the women group, the girls group, like now the men girls, unfortunately they have children.
Yeah.
At home. They didn't continue to complete college or complete high school or even primary.
Yeah.
The father is really suffering. They don't know what to do with these girls. If we can form groups for them.
Yeah.
And that's why I'm going back to the county, sub-county, and the local authority so that they can create land for these nurseries, for the trees which are going to get to 15 million to be planted.
Yeah.
And when the medicine will be ready, the traditional healers are there.
To buy.
Yeah. Yes.
And they get at least an income. They are busy, they have an income.
Like now somebody wants 5 kilos today of withania. Is he practicing in Nairobi? He's asking me now, Dr. Lydia, please, if you have withania.
Withania is
used for blood pressure, diabetes, even cancer. Indians call it ashwagandha. Yes.
It's diabetes, cancer, but also a lot with the cognitive,
It's the best for cognitive health.
Yeah.
So where am I getting the 5 kilos to supply him today?
If there was a youth group, you would have just told them supply.
I just call, I tell them, like now the Moringa, I call the groups in Taita Taveta. Kindly, there is somebody in Mombasa who wants 10 kgs. That women group, they send. Yes.
They have an income.
Yes, they get an income.
They can save, pay school fees and everything.
Exactly. Like now, I'm no longer going to plant my organic wimbi. I have told these ladies, go and plant wimbi.
Yeah.
Me, I need 50 sacks. That one will not take me a year.
The one you're making the fermented porridge and all that.
Yes.
For H. pylori.
So the youth, we have also contributed to the downfall of that generation.
But there's also the question of what of the parents of the generation?
That's the question you're asking. With the parent of this generation, we have contributed to the youth. We don't know what our children want. We are not telling them, with your master's degree, you can do this. You can empower these 11 boys who didn't get a chance to have the masters, be their chair, and you can do ABCD.
Yeah.
We want the girls and the boys to stay in town doing nothing.
Yeah. Everybody's waiting for this white collar job.
Why can't we go 5 steps behind and we ask ourselves, how can we help the boy child?
Yeah.
So that he's not always accused. Every day is accused. I'm not against the girl. You the mother, the current parent.
Yeah.
How have you empowered your girl?
Yeah.
So that she may go to class instead of her going to Ngara, going to Kilimani, to a man's house.
Yeah.
We keep on blaming each other, and yet the process of getting these people to understand who they are at their age, we must be creative. We must be innovative. Innovation is not just coming up with a phone.
Yeah.
Innovation is even the way I'm talking.
It's true.
If you come up with funds, my son here is a communication person. Our boss here, indigenous person. Don't you think we will safeguard 90 youths?
Yeah.
Just 90. Let us start with 90 across Kenya.
Is there one last comment you may want to add?
My last comment is, let Kenyans embrace their culture in health.
Thank you very much.
Thank you for inviting me.
And that concludes our illuminating 2-part series with the impactful Dr. Lydia Matoke. Her expertise offers a powerful reminder that every discipline, including traditional healing and herbalism, holds valuable keys to addressing climate change. Thank you for joining me, Marceline Nyambala, as we explored these crucial perspectives.
Thank you for listening to the Africa Speaking Podcast. Join us in our next episode, brought to you by Toyeza Communications in partnership with Forum Sieve. For any comments and views, you can reach us through our website, www.africaspeaking.org. You can also reach us on Facebook, Toyeza Communications, or on our X handle, @ToyezaComs. You can also write to us on email, info@africaspeaking.org.